Hey, welcome to Ask a Black Doctor. My name is Jasiri X. I am the co-founder and CEO of One Hood Media. We are honored of the show, but also, brings the guest on, books the doctors, make sure that folks are ready and prepared. So I definitely appreciate the Gateway Medical Society. This is a special edition of Ask a Black Doctor because it is, I think, yesterday was the first day of Hispanic Heritage Month. And so we wanted to have a conversation around, what's happening in our community with our Latinx family. And so we're going to have that show today. And so if we can bring our folks up, I'm going to start with you, George. I know you're welcome back to the show. And I'll just ask you all to tell a little bit about yourselves, your background, and then we'll kind of get into this conversation. So if you can just tell us a little bit about yourself, George, and like what brought you to this work and the work that you're doing right now.
Absolutely, Jasiri. Thank you so much again for inviting myself and Latino Connection to be a part of your event tonight. My name is George Fernandez, the CEO and founder of Latino Connection. We are a social determinants of health, marketing, and communications outreach agency. Last year, at the peak of the pandemic, we came up with a crazy idea to launch a COVID-19 mobile response unit to go out into communities and administer COVID-19 testing when COVID-19 testing was only just a drive-through and people were being turned away from not driving up in a car. Little did we know, be careful what you wish for, little did we know that we would host over 250 plus community-based events for COVID-19 testing and now COVID-19 vaccination. So I'm really excited to tell you and the viewers and the listeners tonight a little bit more of what we've been up to since April of this year when we relaunched that same mobile unit to get out there and start doing COVID-19 vaccinations.
No, thank you. And welcome back to the show. We have our new guest, our first time, on the show with us, Denise Baker. Can you tell us a little bit about yourself and your background and what kind of brings you to this work?
Sure. There we go. My name is Denise Baker. I am a nurse practitioner. I've been practicing medicine for over 10 years in federally qualified health center arena. So the disenfranchised, the people that George is talking about, those are my patients. In addition to that, I work for Primary Care Health Services. I'm a quality manager. I deal with all the statistical data. So I look at our population, the 54,000 patients that we serve, and I try to draw out, statistical data about them. It is interesting during this pandemic, things that we're looking at with our patient population. And I'm just excited to be here. I'm Hispanic, Puerto Rican, from Brooklyn, New York. Live in Pittsburgh. My husband is from Pittsburgh and brought me here. So now I changed from a Giants fan to a Steelers fan. Don't tell nobody. But I'm happy to be on the panel and happy to join the discussion.
Thank you for having us and welcome to Pittsburgh. We know it's a smaller city than New York. But we've hoped that, we've welcomed you with open arms. I come from Chicago, too, so I already know. But I've been here for like 20 years, so I'm hoping that I got my Pittsburgh pass. Please let me have it. And, last but not least, she was on our very first Ask a Black Doctor and reporting to us live from Honduras. Dr. Villalobos, can you just tell us a little bit I feel like you're on the show like every other show. You're like our, one of our star doctors. But tell us a little bit about yourself and then a little bit about Gateway Medical Society as well, please.
Yes. I am Dr. Shantal Villalobos. Yes, I am in Honduras right now, and everything seems to be calm. Please forgive me if you hear loud thunderstorms because it's been raining pretty heavily. But I'm very excited to be here. I am Costa Rican and Mexican, so I'm very excited to be on this episode representing the Latinos strong. We are celebrating today Mexican independence, and yesterday was Costa Rican independence, along with most of other Central American countries like Honduras. And so this is very timely, and we're very excited for this. I am a family medicine doctor, and I just recently graduated from residency, so I've been on the shows mostly as a resident. So I'm excited to now be a full-blown practicing physician in Pittsburgh. I will be serving the community in the East Liberty Family Health Center. And so you can come check me out. I would love to be anybody's doctor. I will be serving a lot of the Latinos in the community, a lot of the other folks. And so my specialty is reaching out to the underserved folks as well as everybody else. And I am bilingual, so it's very exciting that I can have that for folks available. The Gateway Medical Society has been in partnership with Jasiri since the jump of this. It's been a very exciting show, and we're excited that it's still going strong, well past a year now at this point. And we are fortunate relationship. We hope that you guys keep tuning in. A little bit more about the Gateway Medical Society. We are an organization that brings together minorities of color who are representing providers from all different aspects. So not just doctors, but nurses, dentists, pharmacists, really providers in general who are serving in Pittsburgh, but we are also welcoming others folks. It's sort of like a chapter of the NMA, the National Medical Association, Minority Physicians nationwide. So this is the Pittsburgh chapter, and we are called the Gateway Medical Society. And we're here to uphold the truth of holding strong for communities of underserved backgrounds. That's the Latinx, that's the Black community, mostly primarily in Pittsburgh. And so we are very excited to be doing things like this, giving information about COVID and other conditions that are affecting our communities in a show like this. And so that is a little bit of that. Thank you for having us.
Absolutely. Thank you. Thank you. You summed it up, and I see Dr. Johnson in the chat. Definitely, shout out to her. Hope you're feeling better. Kind of scared us a little bit. Dr. Johnson got COVID, but looks like she's doing better, and we appreciate her and all the work that she does behind the scenes. So I did want to start with you, Dr. Villalobos, about I think it came out yesterday. The Washington Post reported that 1 in 500 Americans, and like you said, I mean, we're still doing the show because unfortunately, we're still in the midst of this global pandemic, right? And we still need to get the proper information out to our community. It's a lot of misinformation. We'll kind of get into that a little bit later on. But the Washington Post came out and said, yesterday marked 1 in every 500 Americans has died of COVID-19. Just as a professional, a practitioner, like what does that mean to you as somebody that's been on the front lines during this? And what can we do to prevent more of our loved ones or losing more folks to COVID-19?
I lost a little bit of you there, Jasiri. What was the question?
Is it just when you hear 1 in every 500 Americans have died of COVID-19, this is somebody that's been on the front line, that's been educating our people, fighting for our people. Like what does that make you feel in general? And like, what are some things that you feel like some just general steps that we can do to save some of our loved ones, that are still unfortunately dying of COVID-19?
Yes. So the numbers sometimes can throw people off. We don't know what to think, what's a lot or what's a little. And being in the medical community, from the things we've been learning about, especially things that we're always like consistently learning about what's really scary, what's a harmful thing for the environment, harmful thing for us, harmful thing for everybody. You hear about numbers like 1 in 1,000 or less often. That's still really bad. So to have a number like 1 in 500, it's extremely alarming for us. Someone might think, well, that's every so few. That's actually a lot, especially in a year's time of year and a half now of having this situation, and people have been continuously dying. I mean, I'm very, very worried for us as a nation, for us in the world as well, for having these high alarming numbers. It's not something small, I would say. And I think as much as we have the blessing of having science and being able to have information at our fingertips, we have a funny time right now. The internet, misconceptions, politicizing things. We have so many different things being pulled in so many different directions. We don't know who to trust, what to trust. We have a slew of reasons to have mistrust in not just medicine, but what's being told, right? In our communities, Black and Latinos have been suffering at the forefront for research. And so we don't know what to trust, understandably. But with this mix of information being out there, it's really jumbling things. And so I trust the science. I know what I've been taught, but I want to make sure that I can have my community and my folks protected. So I'm spreading the word, but I would encourage the rest of us to also spread the word to our colleagues, to our friends, to our family. And what we can do is get engaged with people you trust who are educated. Get engaged with people you trust who are in the forefront and have access to information, and then ask plenty of people. If you have a consensus of doctors, and what I like to use is when I see a group of folks who are from the very far left to the very far right saying the same thing, I think that's something that you can trust. And what we are saying here is things like the vaccine, and then trusting in that we are really trying to treat folks and make sure that we decrease the numbers of COVID. We are definitely having the same agenda. People would like to throw that word around. And so we want people to really engage in those that you maybe trust, like these platforms right here, to learn about it and then say, mask up, get a vaccine, really protect yourself. Keep doing the same things that you were doing maybe at the peak of your scare of COVID. I'm not saying to live scared, but I'm saying to maximize your protection. You can still wash your hands. You can still wear your mask. You can still do it even if your area, like Pennsylvania and Pittsburgh, aren't telling you have to wear a mask. And so that's what we can do. So minimizing like the discomfort by not wearing a mask. I mean, like, discomfort yourself a little bit, wear a mask, have everybody mask up, and then get the vaccine can really make a difference right now. And we're hitting round 2 on people getting their boosters. Boosters being different from third vaccine, right? But people are getting boosters at this point. I'm due for a booster. A lot of the people who were the first round on that are at booster level. And so we're looking at people wanting to get more vaccines. People who've never gotten the vaccine in the first place definitely do get caught up.
So I'm gonna circle back around on a booster because I think you brought up that's a good point and kind of where that is. But I do want to go to you, George, because I mean, we talked a little bit about it. You know, I'm somebody that's on the internet. You know, recently it was a big issue with Nicki Minaj. I'm also a hip hop artist and hip hop lover, a fan of Nicki Minaj's music. But you know, Nicki Minaj kind of put out this post about her cousin, friend. And his response to what she said was a side effect to the COVID vaccine. And it kind of sparked all of this conversation. You know, some folks were upset, feeling like Nicki Minaj was misusing her platform. Apparently, she got a call from the White House that they were willing to kind of talk to her and kind of walk her through this conversation. But I feel like, you know, and I don't like for our community, it seems like stories like that spread faster than like stories about like actual science. Those stories spread much faster, and a lot of people, particularly people that are, you know, don't want the vaccine, kind of like latch on to that, and even feel like maybe Nicki Minaj is being unfairly attacked. You're going into communities, communities that are, and like, one, is it similar in the Latino community? Like, is there a lot of misinformation going around? And as you're going in there with your, specifically, like you're going to where the community are you having to deal with some of that misinformation? And what are some ways of best practices that you have where you've you've been successful in dealing with it?
Thanks so much. Thanks again, Jasiri, for hosting this special edition for Hispanic Heritage Month. I want to kind of kick off by talking a little bit about Hispanic Heritage Month and also explaining the difference between Hispanics versus Latinos. Dr. Rhonda gave me homework, and if I don't deliver, I'm going to get in trouble with her. And you don't want to be in trouble with Dr. Rhonda Johnson.
100%.
I'm sure you understand. Hispanic and Latino are often used interchangeably. And the difference is between Hispanic refers to people who speak. I want to give you the actual definition on Google, and then I want to tell you my opinion and my personal story. Hispanics refers to people who speak Spanish or are descended from Spanish-speaking populations, while Latino refers to people who are descended from people from Latin America. There's a funny story from a girlfriend of mine. Her name's Deborah Vereen. She does D&I consulting, and back in the late 1990s, she sat on this panel in New Jersey with a Latino, and he was asked the question, do you prefer Hispanic or Latino? And his answer was, I don't want to be called anything with the word panic in it. So that's a very fun comment. But Hispanic was a government term created in the late 1960s to put into all one bucket individuals who basically speak Spanish or are from any Latin American country. You don't hear of the Hispanic Grammys, you hear of the Latin Grammys, right? So it's typically the more culturally sensitive term, in my personal opinion, and my favorite liking, is the word and the term Latino and Latina. And in today's younger society with millennials, you've implemented the new term Latinx, that really creates a really broad spectrum of anyone and everyone who speaks Spanish, and with pronouns and the he's and the she's, it all boils down to Latinx as the new term. But I'm more of an oldie. I'm a huge fan of Latino and Latina, and that's my personal preference and choice. And yes, my team and I have had the blessing and the opportunity to partner with the Pennsylvania Department of Health and Governor Tom Wolf and Secretary Allison Bean here in Pennsylvania to drive into neighborhoods, predominantly low-income, vulnerable communities. We drive this really large mobile unit called CATE, CATE, and it stands for Community Accessible Testing and Education. It was originally launched last year at the peak of the pandemic in August to offer COVID-19 testing. And you're right, Jasiri. I mean, our communities tend to get more news from hip hop and Latin artists and African-American artists, and we tend to hear them more often than we tend to hear science. And we were at a vaccine clinic today, and guess what we were hearing about? Nicki Minaj. And the word travels fast in our communities when it relates to influencers like Nicki Minaj and other Hispanic American artists who are out there sharing misinformation or sharing their own personal views, and at the end of the day, changing the opinions around vaccines. And allow me to share with you my personal approach and our approach with Latino Connection. Jasiri, is we are sharing facts to erase fear, okay? We're out here sharing real facts. We're sharing real stories, real personal stories. We had a team member whose mother passed away due to COVID, super healthy woman, went into the emergency room with chest pain, and she had COVID-19, and 28 days later, she passed away. Those are real personal stories. We miss her very much. That's someone who that's someone who I shared Thanksgiving with, someone who I shared Christmas with, so that's a very close personal story to me. Personal family members have had COVID. So I'm out here at these COVID-19 vaccination events, sharing my personal stories and telling people, listen, I'm gonna tell you what my story is, and hopefully that'll influence you. But we want you to find a resource that you trust, okay? Talk to people who are in your trust circle and, make your own decision. And, we're more of the approach that you get more with honey than vinegar. I'm not out here to tell people you must wear this, you must wear this, you must wear this. But I do tell people I feel comfortable wearing this. So if I feel comfortable wearing this and I'm here to protect myself, I want you to protect yourself as well. And that's the story we're out here sharing, Jasiri. And I personally also saw the article from I believe it was the article that you shared around Latinos being more vaccinated than whites.
Yes.
I think that really boils down to the census, and a very large portion of our communities, Blacks and Hispanics, don't complete the census, or the census doesn't reach them. And I think that's the data that's being used to produce those numbers. But I'm a huge firm believer that I think people need to make their own decision and make up of their own mind. And when they are ready to get the vaccine, they should consider getting the vaccine. If they are not ready, please consider wearing a mask to protect yourself and to protect others.
Absolutely. And I think it goes back to, too, a lot of times it's, Blacks and Latinos that are on the front lines, that are in a lot of the jobs that were deemed essential worker, and that, sometimes are in a position where we feel like maybe we can't take off because, we might not have that job. And so particularly if you're in one of those positions, definitely, wear your mask. We still have the little hand sanitizer. You can get it now. It was a time where it was hard to get, and definitely try to stay as germ-free as possible. But just like you said, like, we're here to provide information. We're definitely not here to put anybody down for whatever decisions that they make, but we want to make sure that we be a resource for proper information. And I'm glad you brought up that article, because I was going to come to you, Denise, with that, because you're the data person. And this was an article that NBC News actually had put out in August, right when Pfizer became FDA approved. And basically they did a poll where they said, and they broke down the percentage. They said 69% of all adults were vaccinated, but they actually said the percentage of Blacks was 76%, Latinos were 71%, and whites were 66%. So this was kind of, this made me say, maybe feel a little better because, at one point you had the governor of Texas basically kind of blaming his state's lack of COVID-19 vaccination on the Black population. So what are you seeing just as a nurse practitioner? Are you seeing, more members of the Black and Latino community that are coming to get the vaccine? Are you having to, as a nurse, combat some misinformation? And, how has this experience been for you specifically, particularly as you're serving, our community?
So you had like 3 questions in 100%. And some data.
Yes.
I'm not quite sure about the data that was presented. It doesn't seem to be, accurate. But what I'm seeing on the front lines is, most of the Black community, we're vaccinating. We have 9 locations in Allegheny County, and most of the Black community came to us for the vaccine, primary care health services. And so I'm honored to be able to make sure that our community is vaccinated. I have some patients who have some hesitancy, and that's just going to happen. Especially in my Hispanic community, per se, specifically. So I have seen that. Our culture is a little bit different. We rely on home remedies and asking our parents and asking our community what they think, what we should do versus, what maybe science says or like traditional medicine says. And so I use a lot of my opportunities to educate my patients, but at the same time, I can't force them their body, right? But it is my responsibility to give them the information. And so that is what I do. And if you're not going to get the vaccine, please wear a mask and wash your hands. I think over the summertime, everyone kind of got a little lax, and it's very, very real right now. Even if you're vaccinated, you can still get the vaccine. I mean, you can still get COVID. You can be double. Everyone's like, they come to my office and Denise, I'm double vaxxed. I'm like, you could still get COVID, and you can still spread COVID.
True.
And so I just say, like, you mitigate your risk, wash your hands, put your mask on, make sure that you are informed. And then, like, we can't force people to get the vaccine, but I think the vaccine is very helpful. I want to just shift to, if you do get COVID, there are treatments, for COVID. So like the antibody infusion, I think we need to kind of really make sure that we're letting our community know about the treatments that are available. Last week I had COVID. I just got out the hospital 3 days ago. And If it wasn't for the antibody infusion that I received, I don't think I would be here. I'm also pregnant, so my immune system is very, fragile, and I wouldn't be able to fight the virus if it wasn't for that infusion. But it's like not a lot of people knew about it or the criteria or how you can, make sure you're eligible for that. So I feel like our community needs to know, like, if you do get COVID, these are some of your options. You do have options for treatment and things like that. But so that's a lot of information, but that's my answer.
No, that's a great information. That actually kind of takes us into one of the questions that I asked earlier, because one of the things that kind of has became popular around like a COVID treatment, this is coming to Dr. Villalobos, is something called Ivermectin, and it's been pretty controversial in the sense that, like, the makers of it were saying, like, this isn't for COVID. However, like, you have somebody with a platform as Joe Rogan, one of the most popular podcasters in the country, kind of saying this is what he's using. And so then a lot of, and so on one hand, it is, and I'm gonna come to you, Dr. Villalobos, with this question, but it is kind of weird to me. On one hand, somebody saying, like, I don't trust the vaccine, but I'm gonna just grab up something that's also made by a big pharmaceutical company that I also probably don't know what's in. But at the same time, I understand, like, if you got COVID, it kind of goes back to that home remedy thing that you're saying. I mean, that's so right on with our community. It's like, I come from the era of like the doctor is the very last, like I'm gonna do whatever else, which is, I know is wrong. And thank Gateway Medical Society for helping me see past this. But I come from like, I'll try anything, give me some soup, give me whatever. And if I'm on my last leg, then I'll go to the hospital. And that actually kind of harms us. We should, particularly if you're, immune compromised, go to the hospital. So what are some, if you get, Shantal, for those that get COVID, what are some of the steps that they should take? And should they like immediately go to a hospital? And what have you seen, work for the patients that you've treated?
Well, let me start with this. A little piece that you said about what we do, right? Culturally, I mean, oh my God, Latinos, we have remedies on remedies on remedies for everything. And I just heard about some new crazy ones, and I'm like, wow.
Vicks, Vaporu.
Yes, the CMOS, whatever. Yeah. We got a whole bunch of stuff.
Yes.
So, but I'm also, I love family medicine, and I'm also a big believer that there's truth behind it. From back in the curandera days, the medicine that we know now came from somewhere. There was origins of something. Medicines, hint, everybody, just so you know, they're derived from plants a lot of the time, so they're natural, but let's not get into that. So we're just kind of controlling the amounts of things and stuff. So, but I believe that there's a lot of truth to it. So it's not knocking like our traditional ways, because there's something to it, right? Your mom was like, fixing you up when you were sick and they made you feel better. A lot of it's love, placebo. And then the other bit is there's something to it, right? And so I love learning about new remedies and finding the little truths about it from our cultural things. I've looked into a lot of them and say, hey, you know what? We do have little kernels of truth from that, and that's why it works. And this is where it comes from. And then exploring more about it. And the other ones are like, yeah, I don't think that actually works. The reason why it happened was because of this. And so we think about our parents, how they treated us. You're going to first turn to your loved ones, right? Who's taking care of you? Well, if your mom was a doctor, she would know what to do and treat you, fix you up, and tell you all the things, right? If your auntie was a doctor, you'd be hitting her up and be like, auntie says, do this, do this, do this, do this, right? A lot of us don't have family members as doctors. So if you think about it, who do you turn to? It's your loved ones who's taking care of you. Well, if your loved ones are doctors, they can tell you all the things to do that keep you away from the hospital until very last minute, right? And so what we're trying to serve is being your family members. We need more minorities as doctors. That's part of the problem. That's a huge part of the problem. We don't have our own folks and seeing our own faces, treating our own people. And so that's part of it, right? But you think about it, if you have the know-how or know something that could work, that's what you're going to do to try to keep somebody at the hospital. And so I'm trying to think like, okay, there's truth to it, and I can see where you're coming from, but it's not necessarily that medicine is bad, and that's the very last thing you do, because yes, you want to avoid hospitals, but it starts turning this twist of like, oh, that's the thing to avoid. But when it comes time, that's a necessary thing, not it's a bad thing to have, right? And so a lot of times, especially Latinos, we think, especially here in Honduras, you have such poor access to a hospital, people associate going to a hospital with death. Because by the time somebody got to the hospital, it took so long to get there, and they were that sick that they usually do die. And so then it's like, well, if you're going to the hospital, you're going to die. That's just what happens. Because a lot of people end up doing that, right? And so you get those connections. And we want to try to flip that around. We need to have more access. We need to have more people who look like us, talk like us, have been through our experiences in it. So when we have those notions, we're going to fight in its own things. What we want to do is know, if you get COVID, if you get sick at all, reach out to your doctor. If you don't have a doctor, get a doctor. If you're in Pittsburgh, I'll be your doctor. We have a lot of free clinics. I'll tell you where to go with the free clinics. We can post up in the chat. We can have the gatewaymedicalsociety.org. We can have our website. You can reach out to us. We have a lot of minorities. We have the list of doctors there that you can see. If you don't have insurance, we'll tell you how to get insurance. I see patients without insurance. So you got a way to get a doctor, get a doctor. Have someone you can reach out to. So if you ever get sick, if you get COVID, reach out to your doctor and say, here's what's going on. Here's what I'm feeling. So then we can have a conversation. We'll be that family member. Hey, I'm not feeling good. What do I do? That's what we want. We want everybody to have access to say, I'm not feeling good. Like, what can I do? You know what I mean? Tell me what to do. Tell me what to drink. Tell me what I can take. And you can say, you know what? Yeah, some teas can work. Some of this can work. Hydrate. And then it's like, you know what? Actually, you really need this medicine. And so when you build that trusting relationship ahead of time, that really can make a difference. So I would say everyone now, make sure that you're connected with somebody. Somebody who has a doctor, you have a doctor, some kind of connection there. And then talk about your symptoms. Talk about how you're feeling. Engage in conversations before you get sick, but if you do get sick, and you don't have a doctor, it's okay. Scramble, get a doctor, reach out to us, reach out to any of us. We will definitely give you information and help you out if you're sick and you're still not connected. Always and forever, we'll be there for you. But get connected now so that when that time comes, you can reach out. And then I say, listen to the advice that you may hear. You can reach out to your family and say, hey, this is what the doctor told me to do. Do you think it's a good idea? That's okay too. You know what I mean? And we'll be there for your family too. I'm a family medicine doctor. I'm all about the community and having everybody involved. I'll talk to grandma, I'll talk to auntie, and I'll make sure that we all are on the same page. And I'll say, you know what? Tell me about those teas you're talking about. Tell me about that stuff that you got going on at home. Okay, we'll work with that. That's okay to do. You know what? If you can, please try to avoid that because of this, this, and this. All right? And so then have a conversation, get engaged, and then we can tell you what you can do. You know, Denise, so glad that you brought up, and thank you for sharing your experience as of recent, having been sick with COVID. If you get sick and it's early on, if we catch you early and you don't have to be in the hospital, thank God, you don't need oxygen, you don't have like really bad chest pains, we can give you immunoglobulin. So we have medication that we can give you. It's the medicine that's needed for people who don't have to be hospitalized. And so we can get you engaged. We can get you prescription. We can get you over to the location because guess what? It's actually difficult to get. It's not so easy. Dr. Johnson just went through that process and she's a doctor and she had to wait days to get it. And so then we have something that can help cut back the amount of severity, the amount of days that you have with the illness, with COVID. And so it's a great medication to have right now, but then it's hard to access. So please reach out to us because we can say, hey, you're not desaturated. You don't need oxygen. You don't need to be in the hospital. Let's get you on this medication and let's get you on the wait list. Okay, so there's things to do. Or we can say, hey, there's these other things that you can. We're going to keep you watch. Or you want to say, you know what? You're really having a hard time breathing. Please trust me. Come to the hospital. We'll make all the precautions. You have COVID, but we need to get you saturated because I bet you're low on oxygen and we got to get you on. And so then getting that connection, reaching out. And I would say we have medicines that we probably can recommend. We have over-the-counter things that we can prescribe for you or recommend. And then we can probably get you connected in the right way. And so I would answer that question first, and I will lightly say, and we can delve into it more if you want to, Jasiri, about the ivermectin. So put it this way, pandemic happens, many things are going down. Doctors are kind of now saying, what can we do? All the researchers and scientists who now people want to question and not listen to about the vaccine and about certain treatments have been looking into other treatments. Ivermectin came up as something that we're looking into. Can this be possibility to help? So there are many things that are being tested and looked into. If you find a certain population or certain group of people that seem to not have been affected with COVID, that's where the question came up. But it could be completely irrelevant. I will say this. I just heard about something that's happening on Honduras, and people are going and swimming in the ocean every single day because there's a community of folks who have not been getting COVID whatsoever, and they swear by showering in the ocean as a treatment. And so people are traveling to the ocean and going showering in the ocean because of this community that has not been getting any COVID cases. All right, is there some truth to that? Maybe we'll find out about something about the salt regulation. But there's something to these things that we're going to explore with science and with the controlled study. And so let the scientists do what they're doing. And if you believe in the scientists potentially knowing something like the ivermectin, then trust the vaccine. And so what I would say now is if that falls through and there's actually harm, please don't go out and do something that we haven't cleared and said that it's okay. The makers of the medicine themselves have said, no, not for COVID. And so then don't do that quite yet, because you're also going to be harming other people. Ivermectin is a medication that has been used for decades, and it is really helpful for a lot of folks, especially deworming. And worms are a huge burden around the world. And we have a lot of deficiencies, including deaths, and a lot of children are heavily affected with malnourishment, a lot of other conditions and issues because of worms. And this is a medication that we need to help deworm folks, including a lot of other things like scabies in the US. You maybe have been treating yourself because maybe you had scabies at one point, or lice, hard to treat lice. So things like that are very important to keep in mind. And we do not want to be taking away from medications, kind of like what happened with hydrochloroquine back at last year. And there's a shortage. And now folks with malaria and people around the world, there's like this huge shortage because people said that word and boom, it was off the charts, right? Nowhere to be found. So let's not do that with ivermectin. Please, let's be considerate. And then let's trust the science. Wait for that to come out. Let people tell you, because we have other medicines right now that we do know work. So let us use those medicines for you before you go to use ivermectin, and get the vaccine because we know that works.
Absolutely. You want to hop back in, Denise?
No, I feel like, I just want to stress that, yes, it might be hard to get the medication, but it's important that our people have a linkage to care. So like if, they need to be able to call a doctor, be able to make an appointment, to be able to discuss their symptoms and find out if they're eligible for, the proper medication. That's like the first thing to make sure that has to happen. We can, oh, you come to me, and there's so many different health centers in Pittsburgh. I just need someone. I need them to make an appointment and establish care, so that if something happens, then they have somebody to call. If I didn't have a PCP, and if I didn't, know better, I wouldn't be able to get the treatment that I got, and me and my unborn child wouldn't be okay today. So I would just say, I would just encourage everyone to, if you don't have a PCP, just make sure that you have somebody that you can call. Get established, even if you're not sick right now. It's important, especially right now during this pandemic. It's very, it's real out here. It's real.
And there's you have a comment. I just want to pull this comment up. From William Baker.
That's my husband. He's over here.
Absolutely.
He's at practice shouting me out. I got 3 other boys, and I have another boy coming. I'm a boy mom, and he shot me out in baseball practice. Hilarious.
Nothing wrong with that. We got a question for you, George. It says you've been offering mobile vaccine clinics to various Latinx, Black, and low-income communities in the state of PA. Can you share some of what you have learned? And I'm curious to say, even when you're going directly to people with the vaccine, do you feel like folks are more willing to take it because you're coming to them, as opposed to maybe them scheduling and going someplace else? What are some things that you learned with that work that you're doing?
Jasiri, this type of work is so rewarding. I mean, just a month ago, about a month and a half ago, we hosted a clinic with a very large employer, Mushroom Farm, in Berks County. And the clinic was not only open to their Hispanic and African American employees, it was open to their respective partners, their husbands, their wives. But furthermore, it was also open to their entire family members. So we were seeing grandmothers and grandparents who are upward of 80, 90, and even 100 years old. Those were folks who qualified for a vaccine last December, last December. But guess what? They don't have a phone. They don't have internet at home. Many of these families were very low income. And you literally we had team members and nurses with literally crying and tears coming out of their eyes and, running to cars to get people vaccinated. Mm-hmm. So talk about the true technology divide that exists in this country, that for many months, people needed to pre-register and pre-schedule a vaccine appointment. They couldn't just walk into a pharmacy like you're able to do so today. So it's very rewarding to be doing this type of work. But furthermore, what I want to stress, that the fact is that we are sharing facts to erase fear. And, we're having really good, ample, open, respectful conversations with folks that are not yet sure if they want to have the vaccine. And they're coming out to our clinics to ask questions. They're coming out to get free resources like a mask. We're meeting them where they are, where they feel comfortable in their own respective communities. We're meeting them at grocery stores, corner stores, bodegas, barbershops. Like you talked about your barbershop earlier. I want you to talk about that in a little bit, Jasiri. And we're starting to partner with Fqhc's, federally qualified health centers, and Denise knows this. Many Fqhc's are starting to offer incentives when incentives are available. They're offering gift cards. They're offering, food boxes and so forth to encourage people to get vaccinated. What we are seeing is that people are open to having the conversation. If we respect their opinion, they'll respect ours. But we're out here telling people, please find your inner circle, who you trust the most, and ask them, should you get vaccinated? But what we have seen a very large number of conversations, Jasiri, happen around, if my child is not yet vaccinated, why would I get the vaccine? So I'm confident that once we see Pfizer and Moderna open up their age group and criteria, for that 5 to 11, I think we're going to start to see a really large number of potential Hispanics and African Americans actually get the vaccine. We're seeing a lot of Dominicans, a lot of Puerto Ricans, a lot of Ecuadorians, and many other Latin American countries who are not going to get the vaccine until their child is also protected. It's sort of like a mentality thing about, ¿por qué protegerme a mí? Why would I protect myself if my child is not protected? And our team at Latino Connection, we're out here again sharing facts to erase fear. We're giving them the CDC data. We're giving them the science facts. We're giving them the literature in their own respective language, with our bilingual community health workers. And people are still opposed to getting the vaccine. So what we're also seeing is folks that we met in June who didn't want to get the vaccine are also now getting the vaccine. So it's also about continuity of education, and the more they see you, the more they hear from you, you build that trust. And once you become a trusted source for them, they are more likely willing to consider getting the vaccine. We're also seeing a large increase of people coming out to events on Saturdays and Sundays when they happen to be off of work. Our team is also doing clinics on Sunday afternoons after church. We're starting to get requests for clinics on Sundays from 6 to 9, when people are off work and multiple people have multiple jobs, and, they have to work multiple jobs to be able to, put that bread and butter on their table. So it's finding that trusted resource and building trustworthy within the communities that you're looking to reach. Just a few days ago, Governor Tom Wolf visited one of our COVID-19 clinics. It was great to have the governor. We were able to vaccinate upward of about 15, 20 people at that one small clinic. The governor will be visiting us again sometime next week at another clinic in York, Pennsylvania. So it's just it's encouraging to have trusted voices and African American doctors and Hispanic doctors be available, and Hispanic nurses and African American nurses. It's important to have the people who are administering the vaccine to look like the ones who are giving the vaccine.
True. And then I think you make some great points in terms of even like access to like vaccine information, because I'm on the internet, so I'm seeing like a lot of times it's like click this link, fill this out. But if you're somebody that's not on the internet like I am, and you're working, like you said, 2-3 jobs, if it's 9 to 5, that's something that you're probably not going to be able to go to. You have to be able to make time. And then there's some folks that might even think like, well, if I get a shot and I have symptoms, I might miss work, and that might cause me to lose a job. And so I think, like you said, like we got to lead with love, and we got to lead with understanding that everybody's situation is not the same. It's not like me where, I kind of do my own thing and I can set my own hours. Everybody's situation isn't like that. And let's have grace for some folks of what they're going through. And I think ultimately, if we're continue to come with love, then ultimately that's what we'll get back. So I just really wanted to shout you out and say I appreciate your support. I want to come to you, Denise, because we have a question for you. And this is really because you've talked about like having a primary care person. I talk a lot about like how, I didn't even know like I could pick my own doctor. I would just show up and it was like whoever UPMC got me. So where, just like you said, so if I know folks and maybe, George is visiting folks and they don't have a primary care person, what information can we give them, or where can we go to say, here, this is where you can get a primary care person? I mean, we all might want to go to Shantal. I know she maybe can't be the doctor to all of us.
I will take all of you. I'm just creating a new panel, so actually you can.
So federally qualified health centers is the ticket. I mean, I was just reading some stats today, like 36% of Hispanic community is not insured. So that's why we don't really go to the doctor. We don't go to the doctor because we don't have health insurance, and we'll just go to the ER if our arm is falling off. That's probably about it. But the thing is, federally qualified health centers are here in Pittsburgh. We have several, like many of them. You can go on the web, any website to find one. And they're PCPs, and we take people with no insurance. And we will take you for $10 or no dollars. If you don't have a dime, we will take you and we will see you. I can speak for primary care health services. We have 9 locations in Allegheny County. Like I said, we have over 54,000 patients, but we have room and capacity to make to get appointments. I think there's another federally qualified health center, East Liberty. You're saying that you work for East Liberty. They're another federally qualified health center. So all you have to do is pick up the phone and call and make an appointment, and we'll see you. and there's no questions asked. And so then you can have an established PCP. And if you wanted, and most of the people at primary care health services, most of our physicians and nurse practitioners are minorities. Dr. Robin Sims has been on this show several times. I heard she's a rock star here, and she's our medical director, and she's been a pediatrician for 40 years, and she's African American, and most of her patients are Black and brown. So I would just encourage everybody to make an appointment. If you don't have a PCP, make an appointment. Yeah,
absolutely.
I'll just add on to that. If you Google any Fqhc Pittsburgh, like those initials, Fqhc Pittsburgh, things will pop up. Call a number and just ask them, I don't know what to do. How do I get a doctor? But if you'd like to, hit up the Gateway Medical Society, and we will help you and walk you through it or do it for you. Willing to have all kinds of help at your hand to see actually how to go about that.
Yep.
Yeah, and I do want to come to you, Shantal, because it's weird because it seems like this year half of me feels like it's been long and another half of me feels like it's been real short, but we're actually coming back around to flu season. And we had last year flu season actually kind of went pretty well because we were like practicing social distancing and had masks on, and we kind of were able to see the effects of that. But you also can get your flu shot. So can you talk a little bit about that? And also, let's start with like, is now the time that people should start looking at possibly a flu shot or be kind of wary of flu season? What should we be thinking about when it comes to the flu?
So flu is still something to be looking out for. And then to answer quickly the question, yes. Right now, if you have access to the flu shot, get it. Pittsburgh is now starting to have it available in many different areas. See if your clinic, see if your doctor has the flu shot available already. Get connected, find a doctor, establish that, and then get the vaccine. There's a lot of flu clinics. I bet you George can speak to them partnering and adding in flu to their mobile units as well. And then we're even having explorations where we have other folks like Moderna bringing in a mix of like the flu with COVID and like those vaccines where you have it all in one. So these are things that are happening, and definitely now is the time. The earlier is always the better. It's not like you're going to be like worried about running out. Getting it now is going to be a good thing, protecting yourself before everything kind of expands. And then wanting to have all of your kids, knowing the young population has access to flu is always really good. And so then getting them the flu shot, especially right now that they can't have the COVID vaccine, is a good idea. And I'm just going to go ahead and say, for those of you who are wondering if you can have the COVID vaccine and the flu shot together, yes, you can. And so then you shouldn't be concerned about having to mix those. And so we want you to be able to have those vaccines without concern, and getting the COVID vaccine now, getting the flu shot now is a good idea. If you already have the COVID vaccine, get it now. If you're going to be due for a booster, don't hold off on the flu vaccine. If you can have access to it, definitely do it now.
And George, are you doing both of those with your mobile clinics?
Yes, we are thrilled and excited. We are literally just now in the planning stages of possibly hosting anywhere between 10 to 15 flu clinics in multiple counties across Pennsylvania. So we're really excited that, we get back out on the road. We did flu shots last year, and we're really excited to do it again. And Jasiri, I also really want to highlight, FQHCs are so key and vital in communities, especially communities that are undocumented. I'm a product of a single mother of 3 who never qualified for social and human services assistance because we were immigrants. We didn't have a social security number. And guess who was there to care for my asthma? And guess who was there to care for my sister? And guess who was there to care for my brother and my mom? It was an FQHC. And the services are at times free. At times, I remember my mom would pay $3 and $4 for a medication that would cost hundreds of dollars. So Denise or Shantal, if you can speak to how FQHCs work with undocumented and or extremely low income families, that'd be great for tonight.
Yeah.
Denise?
Primary Care Health Services has their own pharmacy. And so we offer at cost. So like you said, a medication that you could probably get at Rite Aid for $25, we can give you for 30 cents. And so we definitely, we don't look at your documented status. We are here to help. whether you have insurance, whether you're a citizen or not. And so definitely there's a lot of perks to being a patient of a federally qualified health center, including pharmacy incentives. So, like I said, at cost, like a Depo-Provera shot, like that's like birth control, that it is $180 for somebody with insurance, but it's 30 cents for our patients.
Wow.
So definitely take advantage of federally qualified health centers, especially during this time.
No,
And
that's
thank you.
I personally, it's a very close topic to my heart.
Mm-hmm.
Coming from a very low income family, when you are sick and you are undocumented and you have to worry about your immigration status and you don't seek care, and the level and the largest number of Hispanic families and Nepalese and Cambodian and Arabic families that are moving into Pennsylvania. And they just are unaware of these resources that are available out there to them. And, we are huge partners and huge fans of the Pennsylvania Association of Community Health Centers. And we work with many Fqhcs across the state. And the way that those people care for our community, it's extremely rewarding. I mean, I get teary-eyed thinking about it.
Yeah.
Thank you. And Kiana put a link too. Okay, go ahead, Shantal.
Oh, sorry, Jasiri. I was cutting up a little bit there. I'll just briefly say, in addition to that, the Fqhcs have an abundance of resources. We have social workers that actually can help you with filing and trying to get documentation. And so then for those folks who are afraid of their documentation status or not having visas, we can help you. I mean, we have translators at the Yang and a lot of people who actually speak Spanish in a lot of Fqhcs. And so then not only are we going to help you with healthcare, but we're going to be able to help you with your situation of immigration and with housing. We have a lot of extra resources that people don't even know. And if you're healthy, you're feeling fine, but you have immigration issues, reach out to us. If you have housing issues, reach out to us because we're there for you.
Absolutely. And I was going to say, Kiana put a link in for Pittsburgh for those federally qualified health clinics. I did, because we only got about 5 minutes left. I know it goes fast, but you had mentioned a few times, Shantal, about the booster. Talk a little bit about what that is and who should be looking to get a booster right now, to help us through this pandemic.
Yeah, no, really good question, because that came up in this last month. We've been kind of having a lot of new movements. There's been a lot of data to show for the longevity of those who've been in the early studies of the vaccine. They saw the amount of immunity that you had to protect you very well against COVID, to prevent from severe COVID and death. And then that immunity starts to, decrease over some time. And then there was a threshold point before it actually gets low enough where this is the point at which we need to kind of boost you back up. And so then that number is about 8 months. And so then the first round of folks who were starting to get the vaccine, and when it was available, was a lot of us in the medical community, a lot of folks who were older in the nursing homes. And so that was November, December. I was fully vaccinated by January, started in December and ended in January. Early January. And so then my 8 months are up. They're about to be available for the boosters. And so folks who have had 2 vaccines and have had 8 months of a gap since their second vaccine, you're due for a booster. And so that's soon going to be available. And we want people to get their booster shot. Now, in this same time frame, the information was out there for folks who are immunocompromised, those with their HIV, those folks who may be having certain chronic conditions of the heart, the lungs, the kidneys, the liver, having obesity sometimes, morbid obesity above 40 at BMI, and a lot of other conditions can make you susceptible, HIV. And so then those people who are immunocompromised and taking certain medications too, they are going to need 3 vaccines. And so then that's not a booster, that's a third vaccine. Third vaccine, you may need to go back now that we have this available and we have the data. Right now, people can get their third vaccine. You don't have to wait these 8 months. You're a third vaccine person. And then other folks are going to be a booster at 8 months gap. A lot of us in the medical community, if you're part of that group or not, you're due. And so that's the difference. Everybody to get that along with the flu vaccine, because this twindemic that we are expecting and trying to avoid is real.
Yeah, and Dr. Johnson just put in the chat the flu. I'll pull it up. The flu shot can be given as young as 6 months. Pregnant women are high risk, and people 65 and older. Persons with asthma, lung conditions should also get the flu shot. And so, man, I have like a million more questions, but we're running out of time. And I did want to shout out a couple of things happening. I saw Kiana put one in the chat. But one, I wanted to shout out Casa San Jose, who we've done a lot of work with at One Hood. They actually have a vaccine clinic every Thursday from 9 to 12 and COVID testing every Friday from 9 to 12. And so you can go to Casa San Jose. They do a lot of work in the Hispanic community in Pittsburgh. Shout out to Monica and the team over there. I want to shout out, I was at the barber today. If you see my little crisp lineup, you know what I'm saying? I was at my barbershop. I'm in East Liberty, Bats Barbershop. And Bats Barbershop is doing Shots at the Shop. Shout out to Bats, where you can come this Saturday from 12 to 2 p.m. and you will get, it's like they give you $100 per, like if you get the vaccine, you get $100. They're doing Pfizer, which was FDA approved. And so shout out to Bats Barbershop for doing Shots at the Shop. And then last but not least, I definitely want to personally thank the Gateway Medical Society for, calling me a community champion. You know what I'm saying? I'm humbled by that designation. The Gateway Medical Society is doing a honoring healthcare heroes. This is going to be Saturday, October 23rd at 6 p.m. It's a virtual presentation. So I definitely, I'm humbled to be one of those alongside Lynn Hayes Freeland, who's an incredible person. I think she just retired from her radio show. She's just been the voice of news for our community for a very long time, as well as Dr. Miller, Stephanie Miller, who's the rising star, and who's been on the show, and we always appreciate her being on the show as well. So thank you, Gateway Medical Society, for all the great work you do. Thank you again, George. And man, invaluable work that you're doing in our community. Denise, we're glad that you, made it through. Shout out to you, your family. Shout out to, I don't know if William is still watching, but shout out to your whole family. And praying for a healthy child as well for you. And Shantal, like we know you're in Honduras, doing that work. Safe travels. And coming back to Pittsburgh, because when you come back, you're going to have a whole community of folks that are going to come, and you're going to be everybody's doctor.
I'm ready.
When you come back. So definitely thanks again to the Gateway Medical Society. This has been our Hispanic Heritage Month. Continue to celebrate Hispanic Heritage Month. Continue to spread the great work that folks are doing in the community that George, Shantal, and Denise is doing. And, holler at us. We'll be back next month for Ask a Black Doctor. Peace. One Hood, y'all.